And I'm thinking about some of the things that I deal with every single day for the rest of my life. My medical care is above, in 23 years, has hit above the $2 million mark just for me. How many people could be vaccinated with just my care? Above 2 million.
I'm pregnant, so you'll have to excuse that. I was diagnosed at 25. I'm about to hit 29 in 2 months. I'll be that way for the next 10 years. My story is very similar to yours. I had a pap smear done. Everything's fine because I actually ended up getting pregnant with my son. So I basically kind of call him my little angel because at my 6-week appointment, they said, well, let's go ahead. It's been almost a year. We'll go ahead and we'll do another one. They did another one, and I got a call at home. I went into a process of wanting to just forget about it for a little while. And he gave me about 6 months to make my decision because I kind of had to make it a little fast. And then I found out I was pregnant. So now I have to see a lot of specialists. I have to have a lot of scans. I have to have a lot of stuff done during this pregnancy, and it's been extremely rough on me, and I'm not even halfway there yet. But through my experience, I went searching for support groups, advice, anything that I could find, and found absolutely nothing. And then I finally found the National Cervical Cancer Coalition, and I contacted somebody on there, and thankfully they emailed me back.
I think that really stands out for cervix cancer in general, that it's such an, it has been and it shouldn't be an isolating problem. And that if you really look, that more than 80% of the U.S. population has been exposed. We don't even know about men, and they're, you know, for anyone to deny it, that they've probably been exposed, it's just not true.
First of all, it's amazing to hear everyone's story, and it brings back what I went through. And that was my wife was diagnosed cervical cancer day before she turned 43. And I still get emotional. I was never an emotional person. I mean, I just brushed off everything. And when I lost my wife, that changed a lot of stuff. I'll try to do this. But it was the hardest thing that I ever went through. And it was something I didn't know anything about. And I thought it was something that was easily going to be fixed. She has a sister who has breast cancer at an early age, and she didn't like going to the doctor. 9 months later is when she was diagnosed with cervical cancer. And it was something like your sister. It was very fast. She was diagnosed in September of 2001. I lost her in February of 2002. And I remember something that you said about fighting. I remember having that conversation with her, that you have to fight, because I wanted her to stay with me. And that was a hard thing to do. But she did fight, but she lost that fight. And I felt like I couldn't do anything, and I desperately wanted to do something. And so when she did die, I said, I'm going to do something to make sure that other people don't have to go through this. It feels kind of awkward sometimes, but I have 3 sisters, and one is very religious about going to the doctor, and the other 2, you have to really fight, to say, you have to go, And I've noticed that the more I talk about this or bring it up at work, women have come up to me and said, thank you. I've gone because of hearing your story. And so I think that that's the key is just keep getting that story out and showing how important it is, because somebody doesn't need to die over this, It's and it's tough being a spouse of losing somebody that you love very much.
And to recognize that this is not just a woman's disease. This is, we now know that it does cause head and neck cancers.
Yes.
And that we don't know yet how effective the vaccine is against that, but it causes anal cancer, penile cancer, vulvar, vaginal, cervical, head and neck. This is everybody's problem.
When I finished medical school, I thought back to the few patients that made an impression on me, and it was invariably the ones with cancer. It's very difficult and challenging sometimes, and obviously embarrassing to talk about your sexual health practices to a complete stranger. And so as a physician, I think it's important to be open, to be approachable, and to be proactive about broaching the topic with your patients. I was reading some materials on my flight here, and there's a survey that was done in America that shows that only 40% roughly of Americans have heard of the HPV virus, and only 20% know of its link to cervical cancer. So when you look at primary prevention, that means that you're essentially not allowing the cancer to even ever arise. And so that would be with the vaccine, which controls, I think, about 70% of cases. And then you have secondary prevention, which is when you diagnose early and you're able to cure and manage it. And that's with the pap smear. So this is one of very few cancers that we should not be even talking about.
This is everybody. So I think that that's the key thing to remember, is that we're all in this together, and that I think that what I would like to see happen is that cervical cancer survivors and their family members have a really loud voice.
Which is cervical cancer kills one woman every 2 minutes. That's over 200,000 deaths a year. And that is incredible when you think about that.